Modern healthcare in Europe is facing several challenges. To start with, the rapidly aging population and the rise of chronic diseases are straining our healthcare systems. Second, hospitals are struggling with operational inefficiencies. Third, there is a clear mismatch between the demand for care on one hand and the availability of resources such as healthcare professionals and other healthcare resources. Our Super IoT concept addresses those challenges with advanced yet sustainable reconfigurable communications and localization systems based on the use of radio and light technologies. Today, we are here at the Vitality Hub at the Eindhoven High Tech Campus, and we will showcase the demonstrator number 2. Previously, we have seen demonstrator 1, which was focused on the capabilities of the IoT node. The demonstrator 2 showcases the capabilities at the network level, and we will do this in a healthcare environment.
IMEC Netherlands is working on accurate localization based on Bluetooth channel sounding. So this is the RF part of the dual mode communication, localization, energy harvesting in the Super IoT project, where this part is the RF based localization. And in this demo we have a medical environment with a reception desk, a patient waiting room where the patient gets an intake like blood pressure measurements or some initial medicine, and the patient will go to the surgery room. This patient will carry this Super IoT node. It contains the patient personal data and also can read environmental sensing parameters like humidity, temperature and other sensing parameters. The patient can then put this below a light source like the lamps that communicate to this tag, and when the patient moves away, for example to the waiting room or to the surgery room, then all the information is tracked by the RF-based localization system.
Being able to attach a smart label in the future to each patient and equipment will allow to easily find them and manage them, but also having the history of movements will improve efficiency and operations in hospitals and clinics. So what we are seeing here is Vitality Hub, where we have here different nodes attached to patients, equipment, personnel, and you can see in real time where they are, and even search, for example, for a specific patient and know exactly where it is. This can improve efficiency and operations, but also another example would be to, for example, search for a doctor that is near a specific place and has a specialty that we need right now, like surgeon or orthopedic, and we can use this to improve general efficiency in hospitals. By combining light and radio, the reliability of location can be improved. When the most important information is the room where a certain patient or equipment is, we can use light to have an accurate room level location, since light cannot traverse walls. In this scenario, we have a lamp with an access point inside the room and a node attached to medical equipment. When the medical equipment comes inside the room, the light communication provides the updated location, and the medical equipment immediately switches to this room in the software platform. When it is important to have higher accuracy and know the exact location, for example inside a room, like knowing on which bed a patient is, we can complement light location with radio location, providing XY coordinates. This use case demonstrates a patient being tracked via the radio location system developed during the project. Because the system provides XY coordinates, we can monitor patient movement through corridors and even identify which specific bed they are occupying inside a room. However, since radio waves can penetrate walls, the system may occasionally detect the patient in an adjacent room, and this is why a multi-technology approach is essential for accuracy. Sensing is another important feature of SuperIoT. By combining different sensors inside the SuperIoT node, we are able to better manage the assets and also monitor people. So we can get, for example, alarms when a patient has gotten worse, or even get alerts if equipment needs some maintenance. This can also be applied, for example, to monitor spaces of clinics and hospitals. In this example, we see a patient sitting with a SuperIoT node. This node is monitoring his temperature, and we receive also in software platform this information in real time. With this information in real time, we can, for example, trigger alerts if the temperature goes over a certain value. And then we can, for example, ask a personnel to go directly to the patient. By using both light and radio together, we can enhance the reliability of communication. For example, when there is possible risks of interference, we can rely on light communication, but if we need, for example, higher range and we don't have light available, we can still rely on radio. This combination helps us monitor constantly patients, personnel, and medical equipment. So what we see in this example is a patient that is going inside a room where there is possible interference and radio communication is not allowed. So when the patient is outside, we get the temperature values read by radio. And when it gets in, the system automatically detects its position and reconfigures the node to only send via light. So we start getting temperature values by light in the software platform. Reconfigurability can be used, for example, to switch communication parameters, but it can also be used to give information for caregivers, personnel, or medical teams. An e-ink display incorporated in a node can be used to change information based on different conditions. As another example, the condition of an equipment can be updated based, for example, on the maintenance state.
Now we have seen Demonstrator 2, where the benefits of combining optical and radio technologies in a sustainable manner are demonstrated in a healthcare environment.